All right, today we're diving into a really serious condition. It's one where common microbes, things that can be found all around us, launch a siege on the very core of our circulatory system, the heart itself. We're talking about infective endocarditis.
So, first things first, let's really get a handle on what this hidden internal threat actually is. Okay, so what are we really talking about here? It's an infection of the endocardium. That's the delicate inner lining of the heart. And it usually zeroes in on the heart valves. This is where bacteria or fungi set up camp and build these really dangerous clumps called vegetations. Remember that word, vegetations. It's absolutely key.
And that's the big question, isn't it? I mean, how does something that might just be living on our skin, or even in our mouth, manage to stage a full-blown assault on one of our most protected and vital organs?
Well, for this kind of invasion to succeed, it really needs two things: a weakness in the heart's defenses and an opportunistic attacker ready to strike. Let's take a look at who's most vulnerable.
See, the infection is an opportunist. It needs a way in, a vulnerability it can exploit. This could be a heart valve that's already been damaged, or maybe an artificial one. It could even be a temporary gateway into the bloodstream that's opened up during, say, a dental procedure. Each of these things creates the perfect rough surface for these microbes to grab on and get a foothold. And here they are, the invading army. You've got Staphylococcus aureus. Think of it as the aggressive frontline soldier. It causes really rapid, severe damage. Then there's Streptococcus viridans, which often comes from the mouth. It's a bit more subtle, causing a slower, smoldering kind of infection. The point is, different microbes have totally different styles of attack.
Okay, so we have a vulnerable target, and we have our invading microbe. Now let's see exactly how that invasion plays out, right on the heart valves themselves.
This breaks down the four-step invasion perfectly. First, the germs get into the blood. Second, they find that rough, damaged spot on a valve and they stick to it. Third, they build a fortress. That's the vegetation. And it's a nasty mix of blood components and germs that actually hides them from the immune system. And fourth, this growing mass doesn't just sit there. It actively eats away at the valve tissue. And, even scarier, pieces can break off and get sent flying through the bloodstream.
Now, as this internal battle is raging, the body starts sending out distress signals. The real key for doctors is knowing how to read these clues.
At first, the signs can be so frustratingly vague. Fever, feeling unwell, night sweats. It can feel like a nasty flu you just can't shake. But the real red flag, especially for clinicians, is on the cardiac side. A doctor listening to the heart might hear a brand new murmur, and that sound is literally the noise of blood flowing chaotically over a newly damaged valve.
And this is where things get really fascinating, how the infection actually shows itself on the hands and feet. Osler's nodes are these painful little bumps, and they're caused by the body's own immune system creating inflammation. But Janeway lesions, they're painless spots caused by tiny infected clots, we call them septic emboli, that have broken off from the heart and are now blocking tiny blood vessels. So one is an immune reaction, the other is a blockage, and that's exactly why one hurts and the other doesn't.
And the trail of clues doesn't stop there. You might see these tiny blood streaks under the fingernails or spots in the back of the eye during an eye exam. Even the spleen can get enlarged because it's working overtime trying to filter the blood and fight the infection. All these signs are pointing to one big systemic problem that's coming from the heart.
So, with all these clues pointing in one direction, how do doctors actually confirm the diagnosis and launch the counteroffensive? It turns out, it's a very specific process.
A diagnosis here isn't based on just one symptom. It's really about building a solid case, kind of like a detective, using a checklist called the Modified Duke criteria. The major criteria are the smoking guns, actually finding the microbe in blood cultures and then seeing the vegetation on a heart ultrasound. The minor criteria are all that supporting evidence we just talked about: the fever, the skin signs, the risk factors.
And here's how the math works out. To get a definite diagnosis, a patient needs to tick specific boxes. It's either two of those major criteria, or one major plus three minor ones, or a total of 5 minor criteria. It's a really precise formula to make sure they get the diagnosis right for such a serious condition.
The counterattack has to be just as aggressive as the infection. We're not talking about a simple course of pills here. This is weeks of high-dose IV antibiotics to really penetrate those tough vegetations. And while that's going on, doctors are busy managing all the damage that's already been done.
In a lot of cases, surgery is the only way to actually go in, physically remove the source of the infection, and repair or replace the heart valve.
So what are the stakes, really? And maybe more importantly, what can be done to stop this whole siege from ever even beginning?
And look, the stakes are incredibly high. If a valve gets destroyed, the heart can go into failure. If one of those little pieces of vegetation breaks off and travels to the brain, that can cause a devastating stroke. The infection can lead to widespread organ damage from the kidneys on down. This is a true life-threatening emergency.
But here's the empowering part. Prevention is possible. For people who are at high risk, taking a dose of antibiotics before certain procedures, like dental work, can stop an invasion before it even starts. And for pretty much everyone, good oral hygiene is a surprisingly powerful defense. It just minimizes the amount of bacteria in your mouth that could potentially find a way into your bloodstream.
Ultimately, when you boil it all down, this is the key takeaway. Infective endocarditis is a life-threatening infection where time is absolutely the most critical factor. Catching it early and treating it aggressively is the only way to win this battle for the heart and prevent those devastating complications.